We know a lot in terms of pathological mechanisms responsible for the cognitive decline in Parkinson's disease. And in the last 10 years, there have been significant advances in the field. And we now understand that the cognitive decline is associated with a number of pathological processes, which include, for example, changes in the dopaminergic system, changes in the cholinergic system. But we also acknowledge now that we have changes as well in terms of protein depositions like amyloid, tau deposition, and possibly neuroinflammation. So the combination of all these abnormalities affecting different systems may lead to abnormalities within the networks in the brain, the nervous system, and are responsible for the cognitive decline in these patients. So this is something that has been developed in the last probably 5 years, and we think that over the next few years there will be even more understanding of the different pathological processes associated with this cognitive decline. There are a number of neuroimaging biomarkers that we've been using in the field to study different aspects of cognitive decline in Parkinson's disease. For example, if a patient experiences changes in executive functions, we're using dopaminergic tracers, biomarkers. And there are different dopaminergic tracers that image the synaptic at the pre or post synaptic level. And so if a patient instead may experience changes more in the memory field, then we also use other biomarkers more associated with the cholinergic system. But as well, we also imaging amyloid, for example, we are imaging tau deposition and neuroinflammation. So all these imaging biomarkers have been quite useful to test different aspects of the cognitive decline in patients with Parkinson's disease. And because technology is also improving and advancing the field, we expect over the next few years to have a new radio tracers and biomarkers able to image the changes in cognition experiences by these patients. There has been an attempt to identify also CSF biomarkers. Probably we're not being so successful so far, like, for example, in Alzheimer's disease, because, for example, in the field of Alzheimer, there are biomarkers associated with tau or amyloid. Here, at the moment, in the field of Parkinson's disease, we are now aiming to identify biomarkers in the CSF associated with alpha-synuclein, which is one of the important biomarkers for Parkinson's disease. So this is a work in progress that I think in the next 5 years will be sorted out. But at the moment, there's still some, let's say, limited knowledge of the use of CSF biomarkers associated with Parkinson's disease. In the last 5 years, I think we really understood that genetics is very important in the evolution of certain complications in Parkinson's disease. For example, we know now that if you have a certain polymorphism for COMT, C-O-M-T, which is widely present in the prefrontal cortex, so if you have a certain polymorphism, you might be more prone to have executive dysfunction compared to other patients that do not have a certain polymorphism. And the same applies also for other forms of polymorphism associated with the dopamine transporter, also known as DAT. So certain polymorphism are more prone to be associated with executive functions compared to others. So this is actually something that has become clear over the last 5 years. And now genetics and different studies in genomic are actually addressing this point of how genetics and epigenetics are affecting the field of cognitive complications in Parkinson's disease. And I'm sure they will become much more obvious in the next few years. Some of them actually are already into the clinical use. For example, amyloid and tau have now there is a wide interest in the field because they might correlate with the cognitive decline in these patients, and also might be used also for clinical trials. So definitely it's something that is going in that direction in terms of clinical translation. But for what we are still lacking is, for example, biomarker for alpha-synuclein, which is probably very important for patients with Parkinson's disease. There is a significant amount of research in the field to identify these biomarkers associated with alpha-synuclein, but still the clinical translation is lacking, and eventually in the next 5 years this will be also covered with new research and probably new outcomes.